All right. Well, good morning, everyone. It's another fantastic but rainy Health Plan Markets Monday. So I appreciate everyone for being on the call. It's live, 9 o'clock here on August 5th. It's a new month, and we're off to the races. So as we normally start, we are here, besides a paycheck, we are here to improve the lives of our community with affordable health care. So thank you for being a part of that mission. Thank you for being on these calls as we push through and get closer and closer to AEP and OE for 2025. So lots of news you can use here as things continue to change and do what they do. So with that, we normally start with our training calendar. So I want to make sure that everyone's keeping one foot in the classroom and the other one in the field at all times. So here we go. So this week it's a little light for training. We anticipate that most of the carriers are continuing to roll out their certifications and ensuring that you're getting your recertifications done in a timely manner. So, as a reminder, not all carriers let us know when you've completed the recertification. So, best practice is once you finish your AHIP, once you finish your recertifications, please email contracting@askhpm.com with a copy of the certificate. Please do that because not every carrier, I know you might not think that, but not all the carriers let us know when you get that completed. And we know first before they even process it. So it's fantastic for us to know so we can keep it in your folder, keep you up to date. And it will also speed up your ready to sell notifications on HPM Shop. So that way we can quickly turn on the certifications and the ready to sell for 2025. So that is best practice. If you have any questions, please let us know. Don't forget that we have an amazing team here. It's not just me, guys. We have an awesome team to support you and your clients. So reminder there, support at askhpm.com. If you need anything at all, we will triage your issue to the right person or 844-696-3975. Okay. So nothing going on Monday, Tuesday here, but Wednesday we have our very own Al Clancy, who's hosting his virtual coffee and chat sessions. If you are new to HPM or you might feel a little lost or behind or you don't know which way's up, this is a great session for you to just kind of find your boundary and find your path here. Al is a fantastic resource and person here at Health Plan Markets, and he is a wealth of knowledge. So think of him as your personal coach. And I know many of you are not even, you've never even met him. Take advantage, please, because he's amazing. WellCare is doing their vision for 2025 at 10 o'clock on Wednesday. Cigna's got their virtual office sessions at 11. And then our contracting team is available uh, at 11 o'clock on Wednesday to answer any questions you might have. So again, if you're getting jammed up with certifications, you're new, you're lost, this is a great session for you to jump on as well. Moving over to Thursday, we've got WellCare doing another session, 10 o'clock. That's their vision for 2025. Devoted is continuing to do their in-person rollout sessions. They will be in Daytona on Thursday at 11. So if you're in that market and want to join that rollout session, please do. We are hosting HPM HQ intro classes hosted by Gabe and Al. Really excited for that. We're going to touch a little bit on that this morning again. And then Friday, we have What About Shop with Tom Ryan every Friday at 9:30. So that is our quote and enroll tool ready to go. And there's going to be some changes happening for 2025. So the sooner you learn this enrollment platform, the easier your open enrollment will be. Do not wait to the last minute to learn the enrollment platforms because you're going to be stumbling and fumbling in the middle of AEP, and that's the last thing that you want to be doing. So learn the tools now, learn the resources now, and at least know where they are so you can figure them out and get them going. Lastly, our very own John Minotti, he has a birthday this Friday, so please wish him a happy birthday if you bump into him throughout the week. So that's a training for the week. Remember, we've got to keep one foot in the classroom and the other one in the field at all times. All right, with that, let's go to home base. This is HQ. This is your home base. This is where you should probably start your day every day as an agent, doing what you're doing out there to help people with health insurance. So Just some resources here. We did pull up that Spark has some new resources, but I wanted to point this out that the Spark Help Center is down under resources. You can snap that up. We're going to go through some important deadlines that they've launched here later on in the call today. But again, just to reiterate, the recertification links are under contracting. You're going to click recertification. Again, as a reminder, you're only going to recertify if you were certified for 2024. If you weren't certified for 2024, you're not going to go here because this is for all the people that currently are certified and they're recertifying. You're going to reach out to contracting and they'll get you the contract started if it's your first time for any of these carriers. Okay. As we're receiving them, we're loading them up, we're sending them out. So if we're missing anything, please let us know. Again, support@askhpm.com. We're here to help you on that. And we want to make sure that you've got everything that you need to be successful. Okay. If you do not have HQ, support@askhpm.com. Just send us an email or give us a call, 844-696-3975. We're here Monday through Friday, 9 to 6. I know we're going through a tropical storm and all that. We're open. It's business as usual here. We didn't have a direct impact. So, yeah, it's a little rainy, but we are working today. So if you have any questions, if you're missing any of these resources, please reach out to us. We're happy to help. All right. One thing I do want to point out, it hasn't been loaded yet. Well, maybe it has. Let's take a look. FFM ACA training is now out. Okay, that needs to be updated. So team, if you could, please update that. The best thing that I found is this article from Health Sherpa to get started with FFM. And I wanted to point out that Health Sherpa actually has free continuing education credits that they can give to you just for completing the FFM or the ACA training through them. So they now have their own platform that you can go into Health Sherpa using their enrollment platform, and you can get in there and get your CE credits done right away. Okay. So take a look at that. And down at the bottom, there's a full walkthrough guide on the complete states that are offering CEs. And if you're in the Florida market, if you're new to FFM, if you've never done it before, you're going to get 5 continuing education hours. If you are returning, we only get 1. So you only get 1 CE credit in Florida. Georgia, you get 3 and 1, and so on and so forth. So the list is here in the article I just posted in the chat there. If you need more information, you can definitely use that. I would love for my team to take this and put it into HQ so that way you don't have to go searching for it. So note to John, note to Gabe, let's get that done. And again, if you don't have a way to get into your HQ, just send an email to support@askhpm.com and we'll get you set up. Okay. So the FFM is live. You can go into Health Sherpa and begin that for 2025. Again, you can go in and get CE credits, so you don't have to scramble at the last minute like most people do. Okay. So I wanted to point that out. The other thing is going through HQ. If you go down to the Spark platform, click that, open it up. There's lots of resources. But one thing I wanted to point out is on the notices, the upcoming deadlines that are happening. And we want to ensure that you're aware of these deadlines because they are going to be coming up very quickly. Okay. So here we go as far as deadlines are concerned. With Spark, one of the reasons why we partnered with Spark to help us is the client retention program. So I'm going to read this, and remember the client retention program is postcards that get sent out to your member with a survey asking them one question. Are you happy with your plan? If they answered yes, then you don't have to talk to them in AEP. If they answered no, you need to go talk to them. And you get a full report on this on your platform at the end of the campaign. Okay. But first thing you need to do is you need to opt into it. And so there's deadlines to that. So I'm going to read this article to make sure everybody's on the same page and to ensure that you are aware of these deadlines, because the last thing that we want is you saying, hey, why didn't my postcards go out to my members? Okay. You're hearing it now. It's August 5th. You're hearing it now. Okay. Here we go. So important deadlines for AEP retention survey campaign. With certification in full swing, AEP is just around the corner. Remember to opt in for Spark's client retention program, which includes our dedicated AEP retention offering. So in order to do that, we're going to show you how to do that. The Spark platform sends postcards and emails to your active Medicare book of business, reminding them you are their agent and asking them to complete a brief survey on their health needs. You will be notified of clients who say they want to switch plans, so you can reach out to them and help. The goal is to help automate your proactive retention efforts so you can spend more of your time directly helping clients and prospects. Here are some important links and deadlines to keep note of in the lead up to our retention survey campaign. Friday, August 16th. Okay, it's almost 2 weeks from now. Friday, August 16th. The deadline to upload your contacts to the Spark platform. Okay, so if you're new to HPM, or maybe you added a few clients and you haven't loaded them in Spark, or you don't have your full book of business loaded, or maybe you transferred in and you need to get your clients loaded up, you have until August 16th to get your clients loaded in the system. Okay. For agents onboarding to the Spark platform, upload your books of business to the Spark platform here. And I'm going to copy that link address and drop it in the chat for you as I'm talking and doing what I'm doing here. There we go. So that's how you upload it. If you have already uploaded your book of business and have new clients to add to your account, complete the upload form here. And this is a different link. So this is for updating clients or adding. Let's put adding new clients. There you go. That's that link. If your clients are not uploaded to Spark before the August 16th deadline, they will not receive this year's AEP retention survey campaign. Only active clients with an active Medicare policy added to their Spark record are eligible for this campaign. So, a couple of questions that I've been getting asked. What happens if they disenrolled? Well, if you mark them disenrolled and they're no longer your client, they're not going to get an AEP survey campaign. That's something else, and we could do a different campaign for those people. They must have an active account that you have indicated that they are active clients. You're not allowed to call them if they've been disenrolled, but we can send other things out to those folks. So just keep that in mind. Again, there's no cost for this, guys. You just have to opt in, okay? Monday, August 26th, so this is at the end of the month, the deadline to activate the AEP retention survey in your Spark account. View your current status and activate the campaign in your Spark platform here. I'm going to copy that link. So just because you have a Spark platform doesn't mean that you have activated your AEP survey. You have to manually opt in. And so that link is coming at you right now in the chat. You can view your status and activate the campaign in your Spark platform with the link I just put in the chat. You can update your marketing profile in the Spark platform at the link here to confirm the white labeling that will appear on your postcard. So you can change the colors, you can add a logo, you can update your picture, so you can make it look the way that you want. So update profile is here. So there you go. So you can do that there. Sign up for our training on this year's retention survey at the links below. AEP Client Retention Survey 25, the 25 survey overview. This is an overview of the client engagement and deadlines for this year's campaign. There is training on Tuesday, August 6th, Monday, August 12th, Wednesday, August 15th. I'm going to have the team load this in the training calendar, so you guys will have all the links there too. The AEP Client Retention Survey Retention Strategies training. This is a follow-up training to guide you through processing survey responses and strategies for retaining your books of business. Okay, those trainings are on August 29th and Wednesday, September 4th. Okay. If you're interested in learning more about the AEP surveys, you could check out info on last year's campaign so you have an idea. For a full guide of important dates and information around this AEP, head to our Help Center page here. So the Help Center page, as a reminder, is over in HQ. You can go down under Resources and you have Sparks Help Center right there. Okay. So those are really important deadlines, because the biggest thing that I want to ensure is that you guys are prepared and we don't have anybody coming to us and saying, hey, I didn't know. Hey, I didn't upload my book in time. Hey, I didn't activate my my AEP survey. And if you, there's nothing we can do beyond these deadlines. It is out of our control. So please spread the word and make sure that you're getting these things done. Okay. All right. With that said, let's move into a strategy. I was inspired by one of our agents and agency partners. Rosie and I had a great talk yesterday about pharmacies and how to work pharmacies, because there seems to be a consensus on a lot of agents working pharmacies and not getting results. And some carriers are offering you guys spots at the CVS and Walgreens, but there's tons of mom and pop pharmacies out there. And I want to kind of go through this. And here's the problem. Here's the problem. The problem is hey, CVS, Aetna, Walgreens, United Healthcare, they're going to say, hey, we've got these pharmacies. And anyone that's worked the pharmacy before, I could tell you they're probably going to say, oh, that's a waste of time. And I'm going to tell you why they're going to say that, because they were working the pharmacy the wrong way. All right. And I'm going to show you guys how to work a pharmacy properly to help you generate leads now and into AEP. So listen up, take notes. I'm going to share with you how to work a pharmacy. Okay, so here's the problem. Most agents say, yeah, I'll work a pharmacy, and they sign up and they're going to sit there for 15 hours a week, and they show up and they sit at the table in the vestibule and they wait and they hope that someone comes to talk to them. The problem is nobody stops to talk to them, and there's two reasons for that. Number one, they see you coming from a mile away and they know you are going to sell them something. Nobody likes to be sold anything. So if you look like a salesperson, you're going to be spotted as one. Okay. So that's the first reason you're probably getting avoided. The second reason is many of these pharmacies have drive-throughs. And so if you're a senior and all you really need to do is pick up your meds, are you going to park the car, get out, walk through the pharmacy, pick up your medications, come back? Some of these folks, it's hard to get in and out of a vehicle. It's hard to get in and out of anywhere. So you're not even going to get the traffic. You're not even going to get the opportunity to talk to that person because they're just not going to come through. Okay. I think about 95% of pharmacies have drive-throughs at this point, right? Especially those CVSs and Walgreens and things like that. They're positioned specifically on that corner to chuck medications to as many people as possible. That's how they make their money. Okay. The only time you might get somebody walking through is like, oh yeah, I got to pick up some deodorant too, or something like that, right? So, so you're not getting the traffic, and then the approach is wrong. So that's the problem that most agents have with pharmacies. But I'm going to share with you a strategy that worked for me and worked for several agents that was able to cultivate leads and create a lead source, a lead river of people that are going to call you and say, my pharmacist told me to call you. Okay. So in the world of pharmacists, all right, in the world of pharmacists, they are the breadwinner. They are the ones that are making the money for that pharmacy. Now, all the other stuff, 98% of that space, it has other trinkets, gadgets, doodads, foods, all the things that you might need to pick up on your corner store, right? It's a convenience store. The profit margin on all of that is garbage compared to what pharmacists are pulling down on the medications. Okay. So every pharmacist is responsible for a profit margin and a revenue stream. Okay. So when a patient comes in and comes to pick up a medication that costs $800 and the member has a copay of $85, okay, and the patient gets to the counter and the pharmacist or the girl says, it's going to be $85 today. And the member says, well, I don't have $85 because I'm choosing, behind the scenes, I'm choosing this medication or I'm choosing my groceries because I don't have $85 because of my copay. Okay. So we call that, the member turns around, they leave the pharmacy, the medication stays at the pharmacist. They didn't pick it up. We call those abandoned meds. Okay. How much money did that pharmacist lose in that interaction? That pharmacist lost $800. So it wasn't the $85. It was the whole kit and caboodle. Lost $800 on that transaction. Okay. So if you know this about pharmacists and you now understand how important it is for members to pick up their medications to the pharmacists. I'm not even talking about obviously we want the member to take their meds so they get healthy or at least manage whatever they're going through. But if they're not taking their medications on the health side, that's a whole nother issue. I'm just talking about the pharmacist right now. What's in it for the pharmacist? Pharmacist is sitting with a medication that was supposed to be picked up. He was supposed to cash in $800 between, the provider or the manufacturer or whoever, and the member, the 85 too, and the $800. He lost out on that revenue. It's gone. Member walked out the door. Okay. How many of those interactions do you think that pharmacist has in a month? In a quarter? In a year? It could be in the hundreds. Abandoned medications could be costing the pharmacy that you're working at 20, 50, $80,000 a year. We don't really know, right? It really all depends on how aggressive that pharmacist is. So, what can you do as an agent? What value prop do you have to help a pharmacist? And what are you going to get out of it? All right. So, your value prop is simple. You can solve, not all of them, but you could probably solve the majority of these abandoned medications. All right. And here's where this comes in. So you sign up for a CVS, sure, your table's there, but you don't need to be there because you're going to have the pharmacist in your pocket. You're going to go up to the pharmacist and you need to speak to the pharmacist. Do not talk to the girls or the guys that's sitting up front that's just picking up the meds and running it on the cash register. You need to talk to the pharmacist because that's the guy that understands the money. Everyone else is on salary or hourly or whatever. Doesn't really matter. You need to talk to the pharmacist. Now, also keep in mind that most pharmacists, there's usually one, two, or maybe even three pharmacists per location. So you got to try to get to all three of them, okay? Or all two of them, whatever you got going on there. You need to talk to these pharmacists and you need to have the conversation that I just said. Mr. Pharmacist, how much are the abandoned medications costing your pharmacy right now? He's going to look at you and say, whoa, this person is different. This person is different. How many medications are being abandoned right now at your pharmacy? And how much is that costing you? Right? So my name is Justin. I work with Health Plan Markets. I specialize in helping people qualify for extra help and reducing the cost of their medications. How do I do this? Well, the first thing is you may not know, but the federal government and the state of Florida, because I'm working in Florida in this example, have several programs that could reduce or eliminate up to 95% of the cost of your patient's medications. So knowing that I can help them apply for LIS or Medicaid or pharmacy assistance programs or anything else that I use benefits checkup for on HQ, right? I am now using my resources to help that person reduce their cost by 95%. Oh, and by the way, pharmacists, you get paid the same amount no matter what. It's just coming from a different pocket. But instead of your member walking out of the door because you charge them $85, your member's going to pick up the medication because you only charge them $9. If the interaction goes well, your pharmacist is going to say, I need a bunch of your cards. Because every time a senior comes in and says, I'm not picking up that med because it's too expensive, you're going to train that pharmacist to say, I need you to call my agent. I need you to call Justin. And they would call. And they'd say, yeah, my pharmacist told me to call you because one of my meds is da-da-da-da-da. Now, maybe they don't qualify for LIS, Medicaid, the pharmacy programs. Maybe they're just on the wrong plan. It does happen. And I'll give you an example of this. A person that may have signed up with a health plan 5 years ago, happy with their plan, really excited about it. They love it. It's the best thing in the world. But then all of a sudden, they have an accident. They get sick. They have a situation. They end up in the hospital. They have new doctors. They have new medications. Their health insurance experience has changed completely. Okay. So the plan that they were on, the one that they signed up for with their past experience, doesn't fit their new situation now. And so now they've been prescribed a medication that may not have been on their formulary because they never needed it before. It wasn't a problem. Or maybe it's a medication that's on a tier 5, tier 4, tier 3, whatever that looks like. And now that person's going to the pharmacy and saying, whoa, these meds are really expensive. I don't have the money for this. So it's not going to come out of the blue, but the situation that changed where they're going to get their medications came out of the blue. So as far as the strategy goes, if you become and position yourself as a resource to pharmacists, as someone that goes in there and has this conversation with them and says, and be genuine, right? Like, here, look, I'm really just happy to help. But what happens? You help that person qualify for LIS, and you have just created a special election period that you can now change them to another plan and you become the agent. Oh, and by the way, you just made money. So it's a win for the member. It's a win for you. You got a new client, and it's a win for the pharmacists. And you're going to go back to that pharmacist and say, hey, do you remember Mrs. Jones that you sent me over? Well, guess what? I have awesome news. I helped her apply for a low-income subsidy program. I saved her 95% on all of her medications, and she's on her way back in to pick up those meds that she abandoned last month. That's how you do it. That's how you work a pharmacy. Okay. If you're just going to sign up for a pharmacy and sit in the vestibule or and at your table and twiddle your thumbs, you're not going to get anything at all. Nothing. And you're going to tell everybody that pharmacies are a waste of time. Meanwhile, somebody that didn't even sign up for that pharmacy walked in while you weren't there and did what I did. They got a direct lead source directly from the pharmacy, sending that person new clients to enroll and help with extra help. Now, this is a little bit harder of a process, right? It's going to take time. So you got to build up your lead source. If you have 5 pharmacies that you have locked down, that you are like, I know the pharmacist, I take them to lunch, I buy them coffee, I bring them snacks and cookies, and they're my, they're my buddy. If you got 5 pharmacists like that and you're running this campaign, you might not need to do anything else for lead source, lead generation. Right? So I'm hoping that this strategy helps folks. I love marketing strategies. I love lead generation strategies. And this is something that costs 0 for you to do. And you can do it today. You can start it today. And I highly recommend that you start the strategy. Guys, open enrollment is in October. Okay? That is 2 months away. If you don't have leads before October, you're going to be swimming in a river with no water. You need to have leads. So every Monday, I'm going to come up with a new strategy for lead generation, 0 cost for you. It might take a little bit of brain power here and a little bit of elbow grease, but I can guarantee you that these are strategies I have proven myself because I have done them. And several people on this call have done them. One of the first places that I hung out with Sergio is he had a pharmacy locked down. This was before they would assign pharmacies and all that. He just set up his table. He made friends with the owner and he would get leads from that. So, so there it is. Sergio did mention search medications on HPM Shop or Spark for a lower copay. That's another strategy that we were talking about. So there's several ways to attack it, but the main thing is you're solving the problem with the pharmacy saying, hey, yes, you have abandoned medications. It's costing your business money, and I am here to help you solve it. And oh, by the way, you don't have to do anything for me except send them to me, and I'll get the problem fixed. I'm compensated by the health plans, right? So there it is. Bud's asking, do you recommend more mom and pop pharmacies or the big full scale retails? You'll probably have more success with the mom and pops, but really seek out the ones that have traffic, right? You want ones that, if you have a slow store, meaning they don't have a lot of customers, they don't have a lot of people coming in for meds, then yeah, you're probably not going to get as many leads. It's all about traffic. So if you see a pharmacy that you're like, wow, that pharmacy is popping, the drive-through is always full, or it's in a good spot and you see people coming in and out all day, or maybe one of your doctors says, hey, I send all my meds to this pharmacy. You can actually ask your primary care the primary doctor that you're working with and say, hey, doc, is there any way that you can introduce me to the pharmacist that you work with? Now you've got a foot in the door. Hey, Dr. Jacob sent me over here to talk to you about how I can help your pharmacy grow and gain profitability, right? So good question. Thanks for the reminder, John. All of our Monday calls are on YouTube. If you haven't, you can subscribe to YouTube in case you miss one of these calls. We're going to do this every Monday at 9 o'clock throughout the rest of the year. So that's a thing, unless it's a holiday or something. But absolutely, there it is. And Tom's adding, this works for doctors who have patients who can't afford their medications. So it works both ways. It's the pharmacy that usually gets the notice from the member saying, hey, I'm not picking up this meds, or it's the doctor hearing back from the patient, why didn't you take your med? Well, I couldn't afford it. So there's two ways to work that angle. But talking about that is another one. So there it is. Next week, we're going to be talking about Medicare Part D and the changes that are happening for 2025. It's really important for you to understand this because your customers are going to want to know what the heck is going on and what do they have to pay for next year. So that's all the time we have. I know folks are asking for my help. Sometimes I get jammed up. Please keep in mind, guys, we have an incredible team that is faster and sometimes smarter than me in a lot of these things. So 844-696-3975. We will connect you with a team member. I'll put it in. John, if you could put it in the chat, just in case there's some new folks there, 844-696-3975. Or if it's not urgent, support at askhpm.com. We are responding within 24 hours. Do you hear that, team? We are responding within 24 hours of anything that they might need. So I am very grateful for all of you being on this call on this rainy Monday morning. I appreciate everyone's ears and brains, and I wish everyone a successful and fantastic week. We will see you here next Monday. Take care, guys.